The next speaker is Pam Triano. She's going to talk about vestibular therapy for balance issues. Pam.
Good afternoon, everybody. You can hear me okay? I want to thank you all for inviting me to come here to speak about vestibular rehabilitation and acoustic neuroma. As Dr. Chang said, my name is Pam Triano. I'm a physical therapist here at Stanford. I work at our Stanford Neuroscience Health Center. We also have physical therapy at the Stanford Ear Institute, working alongside the ENTs and audiology. I was the lucky one who was able to come speak today. Just a quick question. How many of you have actually participated in physical or vestibular rehabilitation? Great, okay. So I don't need to go into the anatomy because you've gotten all of that. I'm sure you're very familiar with that. And as you know, there are different options, including surgical removal, radiosurgery, radiation, monitoring, and then where I come in is the physical therapy and vestibular rehab component. Physical therapy will include prescription of exercises, strategies to prevent falls and home safety, and then prehab for surgical candidates. So exercises can be prescribed specifically for each individual to include balance exercises, gaze stability, so that objects in your field of view aren't sort of jumping around while you start moving your head or moving your body, as well as exercises to help with dizziness. Fall prevention and home safety, we'll talk about that a little bit later. And then prehab, for those of you who may be surgical candidates, we talk about what to expect after the procedure and exercises that may help speed up recovery. After surgery, people may also participate in PT and vestibular therapy, and it's important to work on early mobilization or early mobility after the procedure. And your physician or surgeon will typically provide specific restrictions on that mobility and how soon to start. Then you will gradually increase your activity levels towards returning everybody back to their prior level of function or as close as possible. Exercise programs can be performed several times a day for short periods of time. I'm sure you're all familiar with the vestibular system as well, but the group of semicircular canals in the inner ear help control our balance and vestibular acceleration, deceleration, head movements, and that sometimes can cause symptoms of imbalance or vertigo. Balance is also controlled by our sensory system in terms of what we feel through our feet, what we see, along with hearing. Hearing impairments and vestibular impairments can cause impaired balance. And then on the motor aspect of things, how strong we are in our legs, how quickly we can react with ankle strategies to help prevent falls or hip strategies. Possible balance deficits that one may experience can include difficulty just standing still, and that may actually become worse in the dark when you don't have that visual input to help you see where you are and what's in your surroundings. The standing still may also be difficult when you're on an uneven surface. You may find difficulty in walking straight, and worsening of that when you start turning your head while walking. As I talked about, people may experience jumpy or blurry vision, also worse with walking or when moving your head. And then dizziness, again, worse with head turning quickly or sometimes with bending over. So I'm going to go through some sample exercises. Just note that all exercises need to be individually tailored for each person, and a physician or physical therapist can prescribe exercises specifically for you and what deficits you may be experiencing. So it's things like just standing still, trying to maintain upright posture. Sometimes we have people use a mirror in front of them for visual feedback, or standing against a wall to get kind of that proprioceptive input so you know what upright standing is. We may have people practice standing with their feet apart, with their feet together, and progressing the difficulty level from eyes open to eyes closed. We also will work on dynamic and functional gait or walking activities, so one's ability to maintain your balance while you're walking. Can you walk and turn your head side to side? Can you walk and move your head up and down? Can you turn around 180 degrees or 360 degrees? All different types of dynamic activities while walking. And then there's exercises called gaze stabilization. And VOR, that's the vestibular ocular reflex. So that helps to control, again, the ability to keep your image that you see straight while you're moving your head without it sort of bouncing around. And we work on that with people moving their head side to side as well as up and down. Sitting, standing, walking, standing on foam, different ways to challenge and improve that reflex. I've kind of touched on some of this. The second one, sensory integration. So we may have people standing on the hard surface of the floor, standing on a piece of foam, standing with eyes open, standing with eyes closed, progressing to one foot in front of the other, balancing on one leg, and again, balancing with your eyes closed, feet together, feet apart, feet one in front of the other. There's a whole progression that a physical therapist can take you through. With the walking, you can progress to walking backwards, walking with quick body turnings, walking with your eyes closed, and braiding or crisscross. Sometimes people think of that as the grapevine, kind of like a football drill. I talked a little bit about the gaze stabilization exercises. Sometimes we'll have people put a letter on a wall in front of them, and so they focus on that letter or word and try to maintain vision while turning the head. We often have people use a metronome to help with that, and we give you sort of your target beats to work toward, how many beats per minute. So are you working at 50 beats per minute, 100 beats per minute, 120 beats per minute, and progressing the speed as tolerated? Habituation exercises are commonly given to help people deal with dizziness or symptoms of dizziness, and that can be basically finding a movement that provokes your symptoms of dizziness and having you actually do that sort of over and over so that your body can learn to sort of develop a habit and build a tolerance to that, make the symptoms of dizziness less. Other exercises your therapist may work on with you can include neck stretches. Sometimes after a surgery or procedure, or just imbalance, we stop moving our head and neck so much. So we do sort of full body turning when we're moving and walking around. So working to loosen up the head and neck muscles and all the different ranges of motion. Core stabilization, so working on your abdominals, your deep abdominals, working on good posture and good balance and stability. Basic postural exercises. Leg strengthening, so developing good eccentric control for sort of lowering your body weight or getting up and down from a chair. Working on heel to toe raises, ankle rocking, and that can help with lower leg strengthening and fall prevention. Weight shifting, so that you can learn to quickly react if you start to lose your balance. You want to be able to catch yourself if you're going to be thrown off balance. And of course, we try to include aerobic conditioning, whether it's a walking program, working on a stationary bike, or walking on a treadmill using an elliptical, things like that, to maintain cardiovascular endurance. I listed a few home safety resources here. The CDC has put out what's called Check for Safety, a home fall prevention checklist, and you can find that online. And then Stanford has what we call Farewell to Falls. It's a program where we will send occupational therapists out into the home who will do a free home visit, check for home safety. They also work with pharmacy to see if there's any medication interactions that may be causing symptoms of imbalance or dizziness. And then they do repeat home visit. I believe it's within 3 to 6 months, and then a 1-year follow-up phone call just to see how people are doing in the home. I think they also will provide resources for home modifications if somebody needs a grab bar in their bathroom or near their bed, or different adaptive devices they may need in the home. Other resources local to here for balance exercises. Stanford has what's called the Supportive Care Program, and we have that both at the Neuroscience Health Center and also through our cancer centers. And there are many different programs such as yoga, Tai Chi, and other classes that can help address balance and general conditioning. You can also check with your local community centers or fitness centers whether they offer balance or fall prevention exercises, Tai Chi classes, and more places are coming up with dance classes as well, which is a great way to work on balance. And then this is just another list of resources. The Stepping On program is also through Stanford, and that provides some balance education and classes. Matter of Balance is also here through Stanford. Farewell to Falls I just talked about. the Neuroscience Supportive Care Program, VITA. Have you everybody heard of VITA? It's a great website with lots of resources, vestibular disorders. So that website is there. They also have something called Find a PT. So if you need to look for physical therapy within your local area, you can go to that VITA website to look for a vestibular specialist, or actually I did not list it. The APTA, American Physical Therapy Association, has a website specifically called Find a PT, where you can look for physical therapist in your area. You can try searching for someone who has a neurologic certified specialty designation, or perhaps a vestibular specialty designation. And I think you search by your zip code. And then the Academy of Neurologic Physical Therapy has a vestibular rehab special interest group, and that resource is there as well. There has been a bit of research done specific to vestibular rehab and acoustic neuroma. That font is a little too small for me. Basically, this one has shown that following resection, patients may experience a range of symptoms that include deficits in gaze stability, mobility, and balance. Vestibular rehab may be useful in reducing the severity and minimizing the impact of these symptoms. And that was from 2012. This one is a bit older, but also showing the benefits of including vestibular rehab in your recovery period. And that is all I have for you today. Do you see a question behind the bright light? There's one question here. I don't know who has the microphone.
Does if you had radiation therapy, is that what's causing the continuing balance problems? Does that continue to work on your vestibular nerve over time?
I might defer that question to one of the physicians. Regardless of the cause of the balance impairments and vestibular problems, physical therapy can still be beneficial, and we would sort of approach it the same way, but it may be more impactful depending on radiation or no radiation. I don't know if one of the physicians in the room can comment on that, if the radiation itself.
Oh, hello. Okay, the question was, does the radiation impact balance? Is that the question? Oh, no, okay. So the problem with that question is that you can have ongoing balance problems even without treatment. In patients that are just followed with conservative management, you can have ongoing balance problems if you have surgery, and you can have ongoing balance problems if you have radiation. So I'm not sure if it's necessarily treatment specific. And the nice thing about the vestibular therapy is that it works in all those cases in the vast majority of patients and getting them a lot better.
And sometimes we may say you go through a bout of physical therapy, maybe you do 8, 12 sessions over a course of time. You take a break, you work on your own program, and then if you notice changes over time, we welcome you to come back for kind of a boost or an updated therapy program. I think there was one other question. Yeah.
Yeah, how can you tell whether a patient has reached their full potential? If they feel like they're 90% recovered, is that their full potential, or is it they just haven't worked hard enough and could maybe get to 100%? Like at what point would you call it quits?
So from a physical therapy perspective, we use different outcome measures, and we work closely with the patient to develop what are your goals, what do you want to be able to do, what were you doing before, and see how closely we can match that. But over the course of therapy, we may be measuring things like how many seconds can you stand on one leg, how long can you stand with your feet together, eyes closed, what's your walking speed, and we see if those things improve over time. If they continue to improve, then we just keep pushing and pushing to see how far a person can get. When we start to see either a decline or sort of a plateau, then we start to talk about, okay, is it time to take a break? Have you reached your maximum potential? Are there other barriers to not making progress? Some people just have a hard time doing the exercises. Some people may not be as motivated as others to perform the exercises, or maybe it's just as good as one will get after acoustic neuroma. So it varies case to case. Any other questions? Okay, thank you.
Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. please visit us at med.stanford.edu.